And with the new year almost upon us, it's time to start thinking about the changes you want to make in 2009. And for many, that includes trying to stay healthy. And joining us this morning is Dr. Randy Fagin to talk more about those health-related resolutions. Good morning, Doctor.
Good morning, Quita.
Now, I know quite a few of us link our New Year's resolutions to our health. What do you suggest that people remember when it comes to health and making those important resolutions?
Yeah, you know, New Year's is a great time for us to think about making health-related resolutions. And it's really a review of the last 4 months we've spent together. If you haven't quit smoking yet, you have to do it. It is the single most important thing you can do to affect your overall health. And whether you want to just go cold turkey or use a jug like Chantix to help you out, you just have to do it. Healthy eating habits are important, regular exercise is important, and seeing your doctor once a year.
Now, I know you are an expert in men's health, so what specific advice do you have for men in their 20s, 30s, and 40s? Are there any tests or habits that are really vital to those particular age groups?
Yeah, absolutely. You know, starting with guys in their 20s, you know, this is an age group where obviously we're trying to set the standards. So healthy diet, regular exercises are important, but you also have to see your doctor once a year. You know, these guys are in a strange age group. They're not young enough to see the pediatrician anymore, but they don't think they're old enough to really need to go see a doctor regularly, but they do need to be seeing the doctor once a year. Simple blood work is what we're looking for here. Looking at your red blood cell count, your white blood cell count, your kidney function, and believe it or not, your cholesterol. High cholesterol starts in the 20s, and things that we do in the 20s can actually affect us for lifetime to come. So check your cholesterol, check your blood work in your 20s. As we get into the 30s, guys in the 30s need to start worrying about their heart health, actually, which means we're going to add an EKG to that blood work. In addition, exercise becomes really, really important for this group. So even though they're working harder than they did 10 years ago, they still have to make time for exercise, and playing tennis on the Wii does not count. Guys in their 40s, we have to start screening now. These are people who are at risk for silent cancers, things like colon cancer, prostate cancer. Silent because they have no symptoms. If you don't screen for it, you don't find it. So colonoscopy for colon cancer and PSA for prostate cancer, especially if you have a family history, you must start doing these things in your 40s. Lots of great ways for us to make resolutions to stay healthy in the new year.
Now, Dr. Fagin, last time you were here, you shared some exciting news about the first U.S. trial of a microscopic device that you're using in surgery. Can you give us a bit of an update? Yeah,
absolutely. It's called OptiScan. It's an amazing technology that allows me as a surgeon to actually see at the microscopic level in real time while I'm operating. Now, I've done a little over a half a dozen cases now over at the hospital at Westlake, and although it's very, very early and we can't predict where it's going, we certainly hope that the ability to see not just tissues, but cells is going to give surgeons better information to make better decisions and help their patients to create better outcomes. Lots more to come on this.
All right, that is fascinating. Doctor, thank you very much for being with us this morning. We appreciate it.
My pleasure.
And we will have Dr. Fagin on every other week. And if you have a question for him or a topic you'd like him to discuss, log on to KVUE.com and go to our web link section, and you can ask your question on his website, and he'll answer it in the coming weeks.